I also want to talk about House Speaker John Boehner just this past week in a press conference said that it was important for us as a party, especially in an election year, to tell people what you're for. So I'll ask you, what parts of the Affordable Care Act are you for?
Well, I think one of the things that we're all for is making sure that people will have affordable health care. But the problem is there's so many broken promises in the Affordable Care Act. I think the concepts that the Republicans believe is that not for the government to control your health care, but to have a market-based health care system where you and your doctor make your health care choices and not the federal government.
So are there any specific plans, though, within the Affordable Care Act, say, keeping their parents' health insurance until the age of 26? Are you for any of those parts?
Absolutely. In fact, that was part of the Republican plan. And so there are pieces in there, but I think that the biggest concern that Republicans have is that we're limiting choices for individuals. We're turning a lot of the control over to the government, and that the model that they've put together, it doesn't seem to be successful, and so a lot of people think this program is going to cost more than it was originally planned to do. It's going to limit people's choices. The premiums are going up, and unfortunately, in some cases, people are losing the health care that they were very comfortable with.
So is the Republican Party planning on filing an alternative of some sort to the Affordable Care Act?
We've filed a number of alternatives, yeah.
But one that would actually be successful with Democrats in the Senate, that really gets down and keeps the important parts that you and most Republicans agree with, but also that is something that Democrats would be able to sit down and really discuss, that would be successful, that really actually makes important changes, but still ensures that somewhere down the road Americans are insured.
Well, the problem that we have, unfortunately, right now is that the government's very divided, and so we've sent a number of bills over to the Senate, and Mr. Reid, the Democratic leader of the Senate, has not taken up any of those bills, and so it's really hard to speculate what the Democratic Senate would do, because they really haven't done much, and they haven't reached out in any kind of bipartisan way to working with us on a number of issues, and so I can't speak as to what they would do on health care.
So you feel it is mostly just the difference of working with, not being able to work with Democrats that have held up really actually having a productive discussion about the Affordable Care Act?
That, and I think one of the things is even within the Democratic senators, there's a little bit of divide now. What we do see in the Senate is a number of Senate Democrats that are beginning to run away from Obamacare, and many of them are now beginning to start to call for some change. If a number of them do that, then there may be an opportunity to make some changes to that bill. I think one of the things that Republicans are a little afraid of is that trying to fix something that we feel is so flawed may be as harmful as is allowing the program to continue. And so one of the things that we've called upon the president, he has paused a number of provisions in this act. We've asked him, on a number of occasions, hey, let's pause the whole thing because it doesn't appear.
But for years we've heard repeal and replace. What is the Republican plan to replace? What does that plan look like?
Well, that plan looks like, one is taking off a lot of the constraints that restrain the marketplace right now. Providing, for example, health savings accounts for individuals to begin to build up equity in a health savings account, taking on more responsibility. Tort reform. One of the things we hear of a lot of cases is that the tort reform is driving up the cost of health care. Providing the ability to, portability of being able to take your health care with you. The ability to access more than the markets than just that are in your state. Another provision is to allowing associations to group together and form larger buying groups across state lines. For example, the Lubbock Chamber of Commerce has got a plan where they basically did that. You could expand that same model. So those are some of the concepts that we've talked about.